Hey, are you suffering from sciatica pain right now? Are you having trouble standing, straightening yourself up, or being able to bend over because you just get that jolting pain that goes from your back or maybe your butt area and down your leg a bit? In some cases, it goes all the way down into the foot, and it can be just debilitating. Well, I've got an exercise for you that's going to help out, and it's not what you think. A lot of people think with sciatica problems that you've got to stretch it out to make it feel better. And in fact, it may feel a little bit better for a short while if you do stretch it out. I want to warn you that stretching this out is a huge mistake. In case you found some videos that tell you to stretch it out, or a friend told you to stretch it out, or maybe you even went to a doctor or some other healthcare provider and they've given you stretches to do for sciatica. This is new knowledge. This is cutting edge, latest medical research out there. Let me just educate you a bit about it before I show you what to do to help your sciatica problem. We're finding out in the medical research that if you stretch or give pressure, compress, a nerve that's irritated, it stays irritated for longer. So oftentimes people will go do stretches for their sciatica problem and they may get some brief short-term relief, but what they don't know that they're doing is they're keeping the problem there for longer than it needs to be there, which can cause some serious problems, and in some cases may even lead to a surgery that wasn't needed, or having to get repeated injections, or having to rely on pain medications indefinitely and damage your internal organs. So the advice I want to give you before I show you an exercise is stop stretching it, even if it feels good in the short term. You want to really minimize it to next to nothing, and stop rubbing it or giving it pressure. And if you're out there looking to maybe see a massage therapist for your sciatica problem, proceed with caution. Make sure that your massage therapist knows what they're doing so that they don't exacerbate the problem, because pressing on a sciatic nerve can make it worse. And just to give some of the reasoning behind it, it makes sense that if you press it, it might feel better and you get some short-term relief. The reason for that is because that sciatic nerve innervates a bunch of muscles as it goes down your leg all the way down into your foot. And the muscles that it innervates can often spasm or get kind of stiff and painful. They're not flexible. And so it would make sense to rub the muscle out and massage it. But if you rub in the wrong area and you happen to rub the nerve itself, then you can keep the problem there for the long term. So you got to be careful with that. It's not as cut and dry as just doing a stretch or a massage. You need some expert help to know exactly where to push and press and stretch while taking caution about not being on the nerve, so that you don't keep the nerve irritated for longer than it needs to be. Well, let me tell you what to do instead. One of the most common causes for sciatica is a pelvis bone that's shifted. What I mean by pelvis bone is, you've got your spine that goes up and down, and where your spine ends at the bottom, it meets the bones that come out right here to the sides that form your hips, and then attach to your thigh bones that go down and form the rest of your legs. Those pelvis bones, the ring of bones that they call it right there, have the ability to subtly shift. And in many cases, these bones will shift and compress the sciatic nerve where the nerve exits the pelvis. This shift is usually set up by weak muscles. A muscle imbalance is what we talk about here often. And the common weak muscle that's responsible for this shift are the butt muscles. And you'll be surprised. I just went through a bunch of chain of reasoning and lots of education and training that we've gone through here to be a specialist clinic. But it comes back to the butt muscles to fix a sciatica problem in just about every single case. There are some exceptions, but most cases respond very well to strengthening the butt muscles. So let me show you a great butt muscle exercise. It's called the bridge. You might have heard about it before. We do it a little bit different here in case you've done it in the past and you're thinking, I know how to do bridges. Go through it with me here so that you can learn how to do a bridge in such a way that focuses on the butt muscles and gets the pelvis bones to start to shift correctly, to take pressure off that sciatic nerve. So go lie down somewhere, bed or floor, and you're going to push your back down flat as hard as you can. That's going to turn on your abdominal muscles. Once you've got your abdominal muscles turned on, now you're going to be ready to fire your butt muscles. So holding your back down like you're smashing your hand, now squeeze the tush. And just in this position right here, without even lifting up, just stay right there, back flat, butt tight. You might already be getting some relief. You might already be feeling the butt muscles working quite a bit, and you can hang out here. I want you to hold it there for 10 seconds. Get those butt muscles to clench the whole time. You should feel them getting a bit tired. and then relax after that. And you're going to repeat this 10 times. You might do this every hour, every 2 hours, at least a few times a day, just to get those muscles to activate and get your pelvis to start shifting in the way that it should, because the muscles will pull in the right way if you're firing them properly. But if you make some mistakes, which I'll cover next, you can pull this muscle, this bone in the wrong direction. So the common mistake that's made is people will do everything right so far, like we've talked. They'll push their back flat, they'll squeeze their butt muscles, and then they'll start to lift. And it's okay to lift as long as you don't stretch the front of your thighs right here. Because as soon as you start stretching these quad muscles in front of your thighs, where they attach to your pelvis, it can start to yank the pelvis bone in an inappropriate direction, which can feed into the sciatica problem. So make sure that you don't feel a huge stretch. And if I give you a number to work off of, 0 to 10, 0 meaning no stretch at all in the front here, and 10 meaning it's a huge stretch, you might even tear something if you go any more, keep it at a 1 or a 2 or less. So it's okay to feel a little tiny stretch, but a 1 or a 2 or nothing. Right here I feel about a 1, so I'm okay. I still feel this working quite a bit, and that's the goal here, is to get the butt muscles to tire out and fatigue. So try that out. Do 10 reps, 10-second holds, and repeat this every hour to 2 hours, depending on your severity, and you should find that it starts to help you out. Now, just a disclaimer, it is possible to be extremely irritated in your sciatic nerve, and anything you do will hurt, even a good exercise like this one. If that's the case, you might need to do something different. It might mean you need to take some pain medication in the short term just to get the pain under control so that you can tolerate exercises like this to fix the long-term root problem so you're not getting sciatica repeatedly. But this exercise is a great starting point to get some natural relief from your sciatica problem so that you can sleep better at night, so you can stand up with a little more ease and walk longer and take care of the normal things that you need to be doing every day. Now, if you're looking for more long-term relief from the sciatica problem, you want to make sure that this doesn't turn into some disc herniation, some long-term pinched nerve, something that you might need surgery for or injections for, then let me tell you a little bit more about myself. My name is Dr. David Midoff, and I'm a specialist physical therapist at El Paso Manual Physical Therapy. Here at our clinic, we specialize in helping people keep healthy, active, and mobile while avoiding an unnecessary surgery, injections, and medications. We help people out with sciatica problems all the time. You can check out our website for testimonials of real El Pasoans that have been helped by us with sciatica problem. And we'd love to see if we can help you out. Now, if you're looking for long-term relief, you want to fix this problem for good and learn what you need to learn to get this problem under control and be able to manage it on your own if it comes back, then I want to invite you to apply for a complimentary discovery visit with us. What a discovery visit is, it's a 20-minute appointment with a specialist physical therapist, either in person or through a video call, where we can begin to take a look at your sciatica problem. We'll see how you move through the video call, or if you're here in person, we'll put our hands on all the relevant body parts and joint tissues that we need to evaluate and assess to determine a diagnosis. We'll explain the diagnosis to you, and then we'll talk about what you should be doing and shouldn't be doing to resolve the sciatica problem for the long term. We'll pull out the anatomy books and we'll look at the skeleton and explain to you everything you need to know about this sciatica problem so that you can have all the knowledge necessary to make the best decision about your sciatica problem moving forward. All you have to do to apply for one of these discovery visits is click through this video here, and you'll get taken to a page where you can leave us all your details. Once you submit that information to us, one of my staff will call you back first chance they get so that we can let you know about the next steps on booking a discovery visit for you. I hope that we can be a part of your success story real soon. Have a wonderful day. Bye-bye.